Our next layer of speakers is talking about prevention through service provision. And they're working hard to prevent FASD through providing services to women struggling with their use of alcohol and other drugs during pregnancy. With profound compassion for women and their children and a deeply nuanced understanding of the social context, they work hard to improve the lives of everyone involved. We're going to begin with Dana Clifford from Sheway. And many of you will know that Sheway is an exemplary program for supporting women and their children, and many other comprehensive programs to support women and kids across the country have since been modeled on Sheway. So we have Dana Clifford. She's an addictions counselor at Sheway. She has a BA in psychology and is also a registered psychiatric nurse. And she's worked in addiction since 1984 and at Sheway for the last 18 years. Welcome, Dana.
I started there when I was really, really young.
Yeah. Do the math.
So at Sheway, we celebrated our 20th anniversary in the fall and around September. And it was amazing for me because it doesn't feel like it's been 20 years, and the 18 years that I've been there have flown by. But we felt that it was an appropriate time for us to reflect on some of the lessons that we've learned and how the program has evolved over the years. One thing that you've heard over and over again that is really clear to me is in the past 20 years, the 18 that I've been there, you have to deal with the broader determinants of health if you're working with women in this field. If you don't, I don't really think you're going to get very far, from my experience. The women at Sheway, their lives are characterized by a lot of things that you've heard earlier today: poverty, trauma, unstable housing, if they have housing at all, trouble with the law, unplanned pregnancies, a lot of them have children removed, mental health, mental illness, substance use, guilt, shame. Many women don't have voices and feel that their voices are never heard when they're in systems of health, their social services. Very limited positive experiences of being parented themselves, chronic stress, and a lot of women suffer from cognitive impairment. The things that aren't on this slide is that the women that I work with are very strong, resilient, amazing, courageous, and insightful. Bear with me while I try these things. Shame and blame do not work, from my point of view, do not work in helping the women that I work with decrease the amount of substances they use. Most of the women that I work with define themselves with shame and blame. They don't need anybody else to tell them any more about that. We need to focus on building healthy relationships and trust with our women, and that way maybe they'll be able to access the services that we can provide. If we don't work on those basic needs, building trust and building relationships, they're not going to take the services that we offer. And the most important aspect of service provision is that we are non-judgmental, respectful, caring. We meet women where they're at. We use harm reduction. All the stuff in those maps that you've been seeing around today, that's what I believe in. Probably most importantly is we provide women with hope when they can't find it for themselves. We need to build on their strengths. And we also need to build a relationship with providing the basic care, providing the food, having them come in so that they can find a place where they feel trusted and respected themselves. One of the biggest traps that I've seen in the work that we provide is we get into this women-centered versus child-centered. None of the women that I work with see themselves as women without their children. They're a unit. They're not separate. Regardless of whether they're mothering their child or not, that child is part of them. I found it over the years, it's best to support the mother, to parent the mother, and to teach her so that she can care for her child. Up there, there's a study at First Square. First Square is a unit at BC Women's Hospital that is really important to us. It's a unit where our women go where they can get a continuity of care. They see the same physicians and caregivers who have similar philosophies that we have in the community. First Square did a research, I don't know how many years ago now because I've lost track of time, where they didn't remove the children from, the infants from their mothers when they were born. The infants roomed in with the mothers. And they did these checklists of how many symptoms of substance withdrawal the babies experienced if they stayed with their mothers. Interestingly, the symptoms were noted as being less. The amount of opiates used to withdraw the children, or withdraw the babies from the substances the mothers used, were decreased. And it led to a question that I thought about a lot, is were those babies actually experiencing withdrawal from drugs or from their mothers? A lot of these babies never went home with their mothers, but they had the first 2 weeks, maybe 3, maybe a month of being with their mothers. And I would like to be able to do research 10 years from now to find out where those children are and what experiences or what symptoms or syndromes they have, and whether or not that early positive parenting experiences with their mothers changed anything. The other thing that we noted at that time is when the women were able to stay in the hospital with their children and form that bond, a lot of them changed. A lot of them stopped using. And a lot of them took that strength, as one of our doctors calls it, the miracle of birth, allowed them the opportunity to form a bond with their child and to make the changes that they needed and get into a healing place. The other thing that I think is really important that I've learned over the years is that healing is a process. It's not linear. It's extremely bumpy in many cases. There's numerous challenges. The other thing about healing is, for the reasons that I showed with what our women face with, stopping substance use doesn't get rid of all of those other issues, and often it makes it worse because the substance use is what they've used to cope with all those other issues. And so when you take away their only coping skill that they know without having built in other coping strategies and healthier choices, often their chaos gets crazier. So for me, it's really important when we're talking about healing is to look at it as a process, not this linear thing that you stop using and everything else goes away, because that's what a lot of the women believe. And when it doesn't go away, it's very disheartening for them. The other thing that I think is extremely important is that relapse is part of recovery. And we need to learn how to respond to relapse in a way that keeps the mother and the baby safe. We work, all of us at Sheway work with our clients to design what we call a safety plan. In that, we get the mother to decide who she would leave her child with if she was going to use. And we try and get them to list 2 or 3 or 4 different people. For many of the women that I work with, a lot of their support networks aren't that healthy. And so often it's hard for them to come up with 1 or 2 people that they would be willing to leave their child with who would be a healthier option. Normally, in this process, when we do a safety plan with a client, the client will list as a last resort her MCFD or child welfare worker. And what is amazing to me is over the years that we've been doing this, how many of the women, before they go out and use, actually call their social worker and do a voluntary care agreement, placing their child in care. And it amazes me at the strength that the women have to do that. Okay. We never know when a woman is going to start her healing or when it's going to stop. And I think being there and supporting them is really important. And it's hard as service providers and also as people in the system to get to a place where we know that a woman is going to do well or not. One of the clients that I work with over the last, I'm trying to think how old her kids are. She's had 5 pregnancies, 4 of them with us. And in her first pregnancy, she parented for a short period of time and then relapsed. In her second pregnancy, she had with us, and she parented for about 1.5 years with her partner, and then she had another relapse and went out for a significant period of time. Her partner was able to care for her child, and when she wasn't using, she had access to him, and kept that bond and kept her connection with that child. She had 2 more children when she was really active in her substance use. Both those children were removed in hospital. So when she came to us with her 5th pregnancy, it would be really easy to say, based on her history, this woman hasn't got a chance. That's how she felt. But we were able to work with her and get her to find that she had some hope, and as long as she could use her voice and work towards getting into recovery, stabilizing and using the resources that she had around her, that she might have a chance. She had her child and was able to go home with her baby to Crabtree Corner, which is supportive housing where Sheway's at. We're really lucky. We've got lots of supports. And during that time, she had 1 relapse and had her baby with somebody that she trusted. Came back, sat with me and called her social worker and told her social worker what had happened, fearing the whole time that was it, that her baby was gone. When the social worker allowed her to keep her baby, she got back into recovery and is now, I think her baby's 18 months now. She's not only parenting that child, she has total access to her older son, and she is working towards getting one of her children back and accessing services, accessing visitations with him. And that's a child that she never parented. So if you'd looked at her history, it would be really easy to write her off. We never know when they're going to change. And I think that's why the last point I have up here, that it's really important to be able to provide hope and to be able to give women the strengths that we see in them and be able to feed it back. With this one client that I was talking about, I saw her when she parented her son. I saw her strengths, and I was able to say to her, when you had him, I saw you do this. I saw you do that. You're a good mother. It's really important to help them start developing those healthier coping skills and to get them to work on them. Often they don't see them. They just see all the bad stuff. The other thing that I think is extremely important in the work that we do is that we have to be really creative. A lot of what we've been doing isn't working. About 15 years ago, two of the social workers at Sheway that I worked with really closely got really frustrated because our clients would go into the hospital, have their babies, the social workers would look at their past history, and the babies would be removed, and then we'd have to fight like crazy to get their babies back. So they did something that there's absolutely no legal legislations to do, and it's called, we call it an early referral. What we do is with women that have had histories with the MCFD or child welfare, we ask them if they want to contact the ministry ahead of time when they first find out they're pregnant. Let the ministry know what they've done to change. Let the ministry tell them what they need to do if they want to parent. If they don't want to parent, where they want their child to go so that they feel like they have a voice in this. There's absolutely no legislation to make this happen. The only place that I know this is happening on a consistent basis is in Vancouver. We have a couple of social workers who have left Sheway and are now working in other health regions who are starting to do it there. But it's something that is amazing because you can see these women having voices and, again, getting hope. And being able to work with people from a strength-based perspective. Removing babies from their mothers, I don't think is a very good thing to do because 70% of the clients that I work with were raised by other than their parents. So the system that we put them in isn't stopping the cycle from happening. They were raised in foster care by extended family members. They weren't raised by their mothers. They didn't have positive parenting experiences. They didn't have role models. A lot of what happens in our drop-in is that these women see other women parenting their children and learning how. Most of them don't know how to parent. And so if you can show them that that's normal, that's okay, you can learn it, then they're really much more open to trying, and they don't feel as judged. I think that's one of the biggest strengths of our drop-in is the client that I mentioned earlier was known in our community by many of the people that are also coming into our drop-in, and when they see her parenting, they get hope. When they see her and listen to her story, they get hope. And they also hear from her what strengths it needs to carry on. The challenges aren't only for the clients to change the system, but for us as providers to change the system and not accept what people say, to keep pushing the limits. Why can't we define mothering in a different way than someone having to parent 24/7? We have a client and her partner who are active in their addiction, and they still have access to their daughter. They see her 3 times a week. The deal is they can't be using when they see her. And so usually both, sometimes one or the other, depending on where they're at, will show up and see this child. She's in a very supportive foster care system. The foster home mother is amazing and will bring this baby in. And this baby has access not only to a stable foster home, but to her family who loves her. And it's being able to think outside of the box that allows this to happen. I think we need to challenge ourselves in many ways to do this in many other areas as well. The changes that happened at Sheway only happened because we thought outside of the box. I often have this quote of the day thing that pops up on the computer for me. And a couple of years ago, this quote came up, and it really resonated with me because it helped me understand and keep up to the values that I have in the work that I do. It's by Maya Angelou. I've learned that people will forget what you've said, People will forget what you did, but people will never forget how you made them feel. Thank you.